Obviously, there's been a tremendous amount of publicity on this. If you're watching any of the talk shows, or if you're watching any of the news channels, you know, and I don't think that most of the town hall meetings that have been going on around the country are necessarily reflective of the excerpts that you've seen on TV. I have found that you can have an hour discussion and the 2 minutes of extreme passion are the ones that may be on TV. I would just encourage us to have a civil and discussion. This is an important issue. This is a very, and I understand it's a very personal issue. It's about our health care, you know, and in our stage, my stage of life, it's about my health care. We're going through some issues with Diane's mom and dad, so it's about their health care because Diane, you know, her brother and her sister, you know, they're making some major decisions about their parents' health care, and then of course it's about our kids' health care. And so it is an intensely personal issue, and I know that there are strong feelings on that, but I think we can convey our strong feelings and our passions in a way that is a constructive and will lead to, you know, thanks, Jill, and can lead to a, hopefully a constructive outcome, because I do think that most people believe that there needs to be reform and there needs to be change in healthcare. This is H.R. 4200. This is the bill that has gone through our committee. You know, it's gone through 3 committees in the House. It's gone through the Education and Labor Committee. It's gone through the Commerce Committee. And it's gone through the Ways and Means Committee. Each of these committees has voted this bill out in a positive way. It now goes to the Rules Committee. They can take bits and pieces out of every committee, and in reality, they can come back and they can write a totally new bill and bring it to the House floor without going back to committee.
The comment I have is that I have not read the bill, and I don't think it's necessary for anybody to read the bill. All we have to do is look at the performance of government in other areas. Take Medicare, if you want to stay in the health arena. And we've talked about it for many, many years that it's never been an efficiently run organization. And what is the reason for that? Well, the Congress and the Senate, they can change anything they want, the House, but they don't. That's because of special influences that don't allow that. They're at the whim of a lot of special influences that don't allow costs to go under control, such as Big Pharma.
My colleague from the UP, Bart Stupak, put in a provision that said abortion will not be part of the basic coverage. Okay? I do know that when Congress said we want to clearly direct the commissioner as to what, at least on this provision, what will be in the bill or not, or in the basic packages or not. That got voted down. Now, I wasn't born yesterday, all right? So when I see in the committee that my colleagues said we're not going to prohibit abortion, and when I take a look at Nancy Pelosi, I take a look at Harry Reid, and I take a look at President Obama, and where I take a look at their stand on that issue, I believe it is fully their intent to make abortion services a basic part of health care.
This bill here is unconstitutional. The current legislation before Congress. My understanding of the Constitution, and I don't claim to be a constitutional lawyer, is that Congress has certain enumerated powers, okay? And those powers that are specifically granted to Congress per the Constitution are spelled out. Those that are not spelled out in the Constitution are reserved to the states and to the people under the 10th Amendment. I don't hear anybody in Congress talking about the constitutionality of this legislation.
My understanding of the bill is that it does not direct the health commissioner to put in place a process for verifying that the people who are accessing the plans are in the country legally. Okay? And so if it does not direct the health commissioner to put in verification procedures, it opens up the question as to whether legals or illegals will be covered in the plan or not, because it can say illegals will, may or may not be covered, but it does not specifically say you need to put in place a verification process, okay, then you don't know.